Well, hello, everyone. Good afternoon and welcome. My name is Dr. Angelita Howard, and it is my honor to serve as your moderator for today's School of Global Health student panel. We are thrilled, so thrilled to have you with us as we highlight the voices and experience of our students across our MPH, MS programs, and our PhD programs. These are leaders who are already shaping the future of global health. At Meharry Medical College, we are proud to be the first and only School of Global Health in the United States, a distinction that reflects both our bold vision and our deep commitment to advancing health equity on a global scale. Our mission is very clear to catalyze solutions that optimize the health of our world by preparing scholars and practitioners who think boldly, act decisively, and lead with purpose. We believe in a we, not me approach to global health because meaningful progress requires a collective resolve. Through innovative research, community engagement, and collaborative partnerships, our programs equip students to confront issues ranging from health policy and population health to climate change, behavioral health, and the social and political determinants of health. And we are super excited to share the mission is expanding even further. Beginning fall of 2026, the School of Global Health will launch its newest academic offering, the Doctor of Health Administration program. This program is designed for mid to senior level professionals who are ready to lead system level transformation, advance equity, and drive innovation across healthcare and public health. It represents another powerful step in Meharry's commitment to preparing leaders who can shape the future of health locally, nationally, and globally. Today's panel is an opportunity for you to hear directly from our students, our amazing students. They're trailblazing and they're living the mission and working through this mission every single day. They will share why they chose Meharry, how their programs are shaping their professional paths, and what it means to be a part of a community committed to global impact. So, on behalf of our dean, Daniel Dawes, and our School of Global Health, we invite you to participate in this conversation. As you have questions, drop them in the chat. Make sure that you follow us on our Instagram, our Facebook, our LinkedIn. Make sure that you stay connected with us to understand what we're doing, how we're impacting global health. So, as we get started, our students, each one of them, they're going to tell a little about themselves, why they were inspired to come to Meharry School of Global Health, and how did they know that the program was a right fit for them. All right, I'd like to welcome to our stage our students, and they're going to introduce themselves. So we will start off with Megan.
Awesome. Thank you so much, Dr. Howard. Hi, all. My name is Megan Roberts. I live in Murfreesboro, Tennessee. I'm a young professional with an academic background in health and my professional background in nuclear energy and entry level public health. I earned my master's degree at Meharry in their public health degree program with a certificate in health policy. Currently, I'm a second year PhD student in health law, policy, and management concentration. What led me to choose this program was actually when I met Dean Dawes, so Dean Daniel Dawes, during my last year as an MPH student. He was getting a tour of the MPH building and stopped by our class and introduced himself and his framework on the political determinants of health. I was intrigued by the framework and conducted my own research to which I found the answer to my curiosity regarding the systemic health disparities within minority communities. I chose the School of Public Health, excuse me, I chose the School of Global Health because I wanted to learn more and gain the skills by leaders and educators that currently work within the field of health equity. Thank you so much for inviting me here today.
Thank you. Thank you so much. Well, Sean, turn it over to you.
Good morning, everyone. My name is Sean Smith. I am a Richmond, Virginia native, currently residing in Houston, Texas, and I work at the intersection of health transformation and strategic philanthropy. My career has spanned across many different fields, from working with women and victims of sexual and domestic violence to most recently working in the HIV/AIDS space. I came to the School of Global Health only in a fashion by which I could. I was up at 3 a.m. in the morning, and I happened to come across an article that was detailing the economic impacts that we are seeing because of health inequities. Given my background across the span of public health issues, I decided that it was time to advance my education, and here I am. And I'm glad to be among such esteemed colleagues, and I hope to see some of you all before I depart this May. Yay, ready to go, but happy to be here. And I hope you all will consider joining us as well.
Congratulations, Sean. Yes, you have just a couple of more months and a few more assignments. So you'll be walking through those wonderful, amazing doors. Jayla, we'll turn it to you.
Hi, everyone. My name is Jayla Bates, and I'm currently pursuing my Master's of Public Health here at the School of Global Health. My path into public health really started with my upbringing. I grew up around advocacy before I even had a language to call it. My mom has always believed that healthcare was a right and not a privilege, and she lived that belief out in how she showed up in our community. So watching that shape the way I think about health, equity, and responsibility. And as I got older, I started noticing the deeper patterns behind those disparities I was seeing, especially within Black communities and other underserved populations. And that's kind of how I realized I didn't want to work in healthcare. I wanted to understand the systems that produce those inequalities and are to be a part of changing them. And my experiences working in community health, reproductive health advocacy, and health education really solidified that for me. Those roles showed me how powerful community-based work and education can be when people are given the right information and resources, which played a huge part in why I chose Meharry, because of its legacy and mission. So Meharry has been rooted in addressing health inequities and serving communities that have historically been overlooked and that align deeply with my own values and goals and my upbringing essentially. And I want it to be an environment where health equity isn't just a topic that we study, but it's something that shapes the work that we do every day. So I knew this program was the right fit for me because it combines that academic training and real equity engagement by helping build the skills I needed to work at the intersection of public health and advocacy, ultimately to create a more equitable health system.
Awesome. Awesome. Thank you for sharing. Last, certainly not least, Fawn.
So good morning or good afternoon, whatever time of the day it is where you are. My name is Fawn Rhodes. I'm originally from Wilmington, North Carolina. I tell people if you drive down I-40, it's the last spot that you hit before you hit the Atlantic Ocean. So I am Tar Heel born, Tar Heel raised, and Tar Heel to the day I die. And so what brought me to Meharry, like Megan, was my connection with Dean Dawes. I had read his book, Political Determinants of Health, and I got so excited about it that my friends will tell you I was gifting the book to them. I was like, you got to read this book. This is just like amazing. My background is a health equity leader. I'm a former health equity director in New Hanover County Health and Human Services. And so as I was progressing down my journey, I have my master's in public health from Gilling School of Public Health at UNC Chapel Hill. I wanted to find my next step. And initially I was going to law school. But then I saw that Meharry was actually offering a School of Global Health. And I just was like, please, this punch. And I was like, oh my gosh, and it's going to be Dean Dawes, because it was going to be my life mission in order for me to meet Dean Dawes. And so just on a whim, in prayer, I applied to the school, and I end up getting accepted into the school, and it works perfectly for me because it totally aligns with who I am and my purpose. Some may not know that about Meharry, that their mission statement, or one of their mission statements, is worship of God through the service of mankind. And that is my life. I'm a woman of faith. All that I do leads me through that space. Public health is my ministry. It's my calling. It's my purpose. So it's not just my job. It is truly the fabric of who I am. So having this opportunity to be in the health equity program, so I'm getting my PhD in global health equity, I'm just pleased as punch to be able to walk into the mission and purpose that God has for my life. So that's how I ended up at Meharry.
Wonderful. Thank you all so much. Such great introductions. So, those of you who are out here listening and really getting to soak in what our students are saying, we get this. We get to see it all the time. We are absolutely thankful and really, really blessed to be able to work with such amazing students. So, now I'm just going to start to ask a few questions of our students individually. I want to just kind of dig into some of the things that they're doing and some of the work. So you'll hear about what work they are doing and projects. And again, as you think about people who might be interested in this work, let them know about what we're doing. Let them know how we're doing what we're doing. So Jayla, I want to start with you. Talk to us or share an example of a project or your practicum, because you are nearing the end, or community engagement that really has shaped your learning here.
Yes. So one experience that was shaped that has really shaped my learning is what I'm currently doing. I'm in the midst of writing a manuscript through Meharry's Maternal Child Health Center in collaboration with Morgan State. Essentially, my focus is on reproductive health, increasing awareness and access to sexual and reproductive health resources typically for college students, but that has expanded now to looking at postpartum depression in fathers and how that affects their involvement within their first year of life. So yeah.
Wow, that's really good. I appreciate the connection that you said with Morgan State, just having different connections. And oftentimes people don't realize, even though you attend a school, does not mean that you cannot build bridges, build partnerships with other institutions to really work through some of the to advance what we're doing, because you can't work in silo. So having that cross section community is really, really good. All right, Sean, you talked in your introduction about graduating. So as graduation is nearing, you've been working on your culminating research, your project. Talk to us about moments that you've had working with faculty and other students that have really been impactful for you.
Yeah, so interestingly enough, I started taking a GIS mapping class, and the format for me, because I am on all sorts of spectrums, it was not necessarily conducive to my learning style, but I was able to benefit from taking part in an independent research study and working directly one-on-one with Dr. Wansu M, who leads our GIS mapping courses, to gain a better understanding of how I can utilize the software and those tools in my own work. I'm currently researching medical mistrust, specifically among Black and Latino men who sleep with men, but also across the larger healthcare system. And that has led me to an interest of wanting to, one, completely overhaul how we engage with patients and how we talk about patient-provider trust. And then also making sure that we can provide pathways for folks to access the providers that they need, especially in those healthcare professional shortage areas in rural and urban communities. And so all of my research right now is focusing on medical mistrust. I'm able to use the GIS mapping to locate those professional shortage areas and hope that we can build a system that is more humanistic in nature and actually connecting with the people and not just the clinical metrics that we like to establish.
Wow. I really, really love that. medical mistrust, because when we think about mistrust, a lot of times, especially in the Black community, we go back to the Tuskegee experiment and just where that started, although it started even before then, but a lot of what we reference has been around that. So really getting people's mind around that, around the literacy and understanding how do we move from there, how do we grow, and looking at those zip codes, looking at, mapping based on zip codes. So again, those of you who are watching, when we talk about mapping, even down to the zip code, it matters. It matters where you live, what zip code you're in, what area you're in, rural or not. So thank you, Sean, for certainly sharing that work and what you're doing. Megan, you are doing your dissertation. You are going to year 3. OMG. You're finishing up year 2. You're getting ready. So you were in the deep dive of your dissertation focus. Tell us about it and what you're working on, and why and how does it matter related to advancing health equity?
Yes. So at this moment, and I preference that at this moment because my idea and focus has been changing. But right
That's
now,
okay. That's
yeah,
okay.
yes, that's how it is with this research. Your ideas will constantly change. But right now, my focus is centered on health communication within the clinical space. So specifically, I'm looking at how we can reframe the way providers and systems share information to better support patients with chronic conditions. And recently, I've had to navigate some real world situations with my own health, and even with my background in public health. Um, just recently, when I went to the doctor and things, those interactions left me feeling very disappointed and unheard. So it made me realize that if the healthcare system feels this broken for me, it's likely failing those in the most vulnerable communities even more. So going forth within my focus, my goal is to understand how we can advance health equity by fixing the communication framework, right? So
Mm.
we often talk about how the political determinants of health, the laws and the policies that create gaps, but these gaps often manifest as a breakdown in communication at the doctor's office. So by reframing how physicians communicate, we can ensure the quality of care isn't just a privilege for some, but a standard for everyone that can actually access and understand. So.
Wow, that's so good. Communication. Well, let me go back to first saying I appreciate your transparency about shifting and navigating in this space of health equity. In this space, it's it is easy to, because there are a lot of things that have to be addressed. There are a lot of policies that have to be addressed. There are a lot of communication, as you just talked about, that have to be addressed. So it does become easy to kind of shift. But we also know that at some point you have to make a decision to stand firm on what you're doing so that you won't be here for another 5 or 6 years. And also understanding that as you're going through your project, as you're going through the research, that you can build upon the other things when you graduate, as you write more, as you think about grants, all of these opportunities, as you think about legislation, making those changes, especially. Communication should be the least of the barriers because there's so many ways, but we still have those challenges. So I'm looking forward to you progressing through your dissertation and your focus. Thank you so much for sharing that. Fawn, so in your project, you've introduced this amazing concept of weathering.
Mhm.
Talk to us about, as a student, how you're able to connect those personal experiences within your research. A few students already have talked about, that personal connection, but
Mhm.
as it relates to weathering, share about that and how you're able to connect your personal experience within your research.
So thank you so much for asking. So as you have stated, my dissertation or my research focuses on how does chronic workplace trauma within public health careers contribute to embodied weathering among Black women. My purpose in focusing specifically on Black women because of my, as Megan stated, my own lived experiences. And so weathering, just keeping it very simply, it's just how stress shows up biologically and mentally and physiologically within our bodies, right? So it could be from, I'll just give you my last situation. I had a bout of shingles. And shingles is the only two ways that you can get shingles is one or two ways. Either you're in contact with another person that has shingles or it's stress. And so it's chicken pox, and it lies within your spinal system. And so after you've had chicken pox, then it goes dormant and it lies within your spine. And as I stated, the only two ways that it will come up again is either you are in contact with another person or through stress. Well, I was not in contact with anyone whatsoever at all that had shingles. And I ended up being diagnosed with shingles, which is extremely painful. And I realized that it was the stress that I was experiencing at my former position that I had. And I realized, like Megan also, is that if I'm going through this, there are other people out here going through this situation. And also the other thing that I thought about is as I was looking at how weathering is showing up within our Black women, because when we look at the numbers as far as Black women, we are a very large portion of the public health industry, very large. And public health is extremely large. Oftentimes we think of it just as it relates to like your local public health department, but it's not. It's your local, it's your state, it's your federal, it's your academic spaces. It is all the way to people who may be in community care centers, community workers. So it's such a vast space and how it operates. We're the ones who are there. We're the ones who are showing up. We're the ones who are staying late. We're the ones who are taking on more than we actually should. It's that, we work twice as hard to get paid less, right? And then all of that begins to embody within us. We don't talk about it often with other people. We just push through. We pick up on that attitude as I'm just going to push through, that kind of resilience rhetoric that we push through. So it is incumbent of us to not always put the onus on the individual to make a change. Because why? It is very important for us to look at the structure. And if you know that your employees are experiencing these things, let's see what we can do to structurally and systemically fix those things and offer more than wellness affinity groups at work, or discounts for you to go see a mental health provider. If your environment is providing a place that is causing workplace trauma, then you need to talk about what's happening at the upper level and how can you fix those systems so it can be a better work environment. And as we know, if you fix it for Black women, you're going to fix it for all of us, for everyone that's there. And so to speak on that real quick, when you're talking about a dissertation, you have to be specific. You have to find a very specific population. So you can't just be broad. So oftentimes when we're having these conversations, it is not because we're trying to be isolating from other population groups, but you have to be very specific in order for you to do your research. So that's why I specifically chose Black women, but it applies to all genders and those who are experiencing workplace trauma. Hopefully the information that I find is able to be transformational. So I feel very passionate about it. I'm hoping that it will be an impact to all those when I'm done with my research.
I am sure that probably by the time we finish this webinar today, you're going to have some people in your inbox trying to figure out how they can get to their bosses, their managers, their leaders, their leadership to say, we need to adopt a policy because I'm stressed. And I heard student Dr. Fawn Rose say that in order for us not to carry all this stress, y'all got to change some of the policies. So really, really good. And that is huge. That is huge because you're absolutely right. mothers, people, women, a lot of times we carry those stressors from both home and work, trying to
Mhm.
ensure that we meet or measure up or level up, as people might say. So thank you so much for sharing that. So you all, I appreciate the comments that you've made about your work, your focus, what you're studying, how you're doing all of these studies. One of the things that I do really, really enjoy about being in the School of Global Health is our process of how we navigate education, our pedagogy, how we think about educating students, especially because most of our students are full-time employee. They're employed full-time. They have high-level roles. They have these workforce things they have going on, plus their family, plus other things. It's the plus, plus, plus. So we've adopted a hybrid model where our students, they don't have to come. You all don't have to come to Nashville to be in class every single day or every single week. There are times that you all are on every week as it relates to what we call synchronous learning. So you're in the classroom per se, in a synchronous environment through Zoom or some other communication. And so then you only come about 2 times a year, usually in the fall, maybe once, and then in our in-person residence. So having said that, understanding hybrid, I'd like for you all to share some of the best practices you've gained while being a hybrid student, and how it has been with other pressing matters like work or home life. So just take a quick minute or so to share your thoughts about some best practices you've gained being a hybrid student.
So I don't mind jumping in that space. First, I always like to say there's no balance. We always like to say work-life balance, right? There's no balance. It's work-life integration. How do you integrate the two that you are dealing with? So one of the best things that I will tell you is learn to manage your time. Prioritize, but also put a cutoff time. Don't sit there all day long, all evening long. Get what you need to do, shut your books, and go do what you need to do as far as, whatever other obligations that you have. You need to be able to step away, because sometimes the information that you're learning is heavy. So you need to be able to let it process and think about it, and let it kind of resonate with you, especially a lot of the readings that we have. We have a lot of reading that we have to do. We have a lot of reading that we have to do. And so with all that reading, you want to let it process with you. So learn to manage your time, prioritize in that structure of how you do it, and then set a boundary, cut it off. Find you. I'm a Sabbath keeper, so Saturday is my day of rest. So find you a day and let your day. That is the day I do not do any schoolwork on that day at all. No schoolwork at all until late that evening, unless it is a major issue. But beyond that, find you some day. Let that be your whole day where you are not touching schoolwork whatsoever at all. And then recalibrate and reset all over again. So that is something I would tell you to do, is just learn to manage your time and find your boundary and stick to it.
Thank you.
I can go next. Kind of piggybacking off of that. So the MPH program did not start off as hybrid. We've actually kind of integrated becoming a hybrid for this year. So that definitely pushed my tested how structural I am and my discipline. I consider myself to be pretty disciplined already when it comes to school, but hybrid learning kind of pushes that further. So one of the best practices I've learned is making sure I set up a space where I can actually focus, so that instead of so that I'm not in bed or I'm overly comfortable where I'll kind of get distracted, especially because I'm an easily distracted person. So I'll try to study in the library or at a desk, or if I sit on my couch, I'll make sure like there's no covers on the couch, the remote's not anywhere near me, so that I stay productive. And especially treating like my online days like an in-person class. So making sure I'm dedicating that to almost like a ritual. So dedicating my time, my engagement, minimizing distractions, making sure I kind of stay in that same routine that I would be in if I was going to an in-person class, really makes a huge difference. And then something else is that I know for at least for the MPH program, we are hybrid, so we can kind of pick and choose when we want to go online. A lot of us are still in Nashville, but staying connected with my classmates and my professors, even if it's like just participating in discussions, forming study groups with those that are here in Nashville, and asking questions when I need clarity, to kind of keep that sense of collaboration and to help me stay motivated and hold that accountability.
Thank you.
Yeah, I will support all of that, especially the work-life integration. I had a very transient life. It was always a joke in class, Sean, where are you today? I was always on somebody's plane, literally every week or two. I was in a different city. So much like Beyonce, if you saw me, my MacBook was with me. So I think really just being able to, absolutely what Fawn said, find ways to integrate the work into your already established life. That way you aren't overwhelming yourself. I am also an easily distracted person, probably president of the club. And so I had to find ways that sort of work with my, the way that I process information. So sometimes I was doing work in bits and pieces. I may sit down, do things for a couple of hours, and then I may go off and watch TV just to give my brain time to rest and reset. But while I'm also watching TV or reading something else, I'm finding ways to connect the information that I read for my class to the things that I'm experiencing in that moment as well. So always finding some type of feedback loop in order to digest the content. But I really think it's just, like Fawn and Jala have already said, find ways to integrate the schoolwork into your established routines. That way you aren't completely overwhelming yourself. But yes, just because it's hybrid does not mean that the work is any less stringent. I think that you really have to focus. You do have to be intentional about what you're doing and how you make that integration. But find out what works for you.
Thank you.
That is absolutely correct. To echo my classmates here, being in a hybrid setting as a student and a worker, there are a lot of challenges, but as my classmates have said, the success has been in integration and in planning. So I have to give a personal shout out to our classmate, Yepsira Meharry, who took the initiative to create a cohort WhatsApp group day one of our in-person orientation, and that has been a game changer for us all. So the group has created an organized and inviting space to where we could stay in constant contact, share resources, and keep one another encouraged. So having that immediate support system makes the hybrid part feel less like learning in isolation and more like being in tune with one another. So my advice would be to never let the screen be a barrier to building real relationships and establishing connections, because we have the tools. So make the fire.
Wow. I love that. So building those relationships, being intentional, taking time off to rest, relax, and being focused on what's ahead of you. I appreciate all of the things that you all have said, and just how you stay connected to the great thing about what you're writing and in graduate school, especially in these programs, if you're doing a thesis, dissertation, whatever those things are, finding something that connects to you and what you enjoy doing certainly will help the process. So, thinking about, go ahead.
I add really quickly, for
Yeah.
those who are, differently abled in terms of their learning, I also highly encourage you to use the disability services that are available on most college campuses. I think a lot of students don't know to seek out those services, but they can provide you with things like extra time for tests or extended deadlines if you need them. Everybody's plan is different, and you work with your professors to make sure that you have a path forward, a learning path that is helpful to you to move you forward.
Oh, I love that. Yes, absolutely. Most, if not all, colleges should have accommodations or disability office. Thank you for pointing that out, Sean. And it is important if you believe you have, even if you have not been diagnosed and you're like, but I'm having trouble focusing, I'm having trouble, keeping up. I know that I can do the work, and when I get my grades back, they look well, but I'm having trouble in these areas. Go talk, never be ashamed. This is why we're here to help. So thank you for pointing out that, Sean. And so thinking about challenges and change and things of that, Megan, how have you been challenged through the degree program, and how have our faculty, staff been a support to some of your challenges?
Yes. So the transition into doctoral level work in a year from graduating from a master's level program has definitely challenged me, particularly in elevating my academic writing and thinking skills to meet the high expectations of the faculty. The skills that I've learned in my graduate level coursework was elevated, and I learned pretty quickly that I needed to spend time having conversations and researching better ways to communicate complex issues to action. So even now with my dissertation research and interest, personally, I think broadly and want to solve the world's problems in a year. And I've come to understand that I am not at the capacity to do that. So the faculty and staff have been incredibly supportive throughout this process, with their ability to make themselves available for personal check-ins, leveraging opportunities that are of interest to our field, and also providing recommendations for outside resources, whether it's connecting me with professional organizations within Nashville, suggesting relevant conferences in other states, or sharing networking opportunities on LinkedIn. They truly invest our growth beyond the classroom and make themselves available for that.
I'm glad you said it again, that you cannot do everything you want to do in 1 year. Very, very good. So that means somebody we are helping. And I appreciate that, faculty and staff. And that is certainly one thing. I see a few of our faculty on now, and that they do share resources, that they do share how to navigate through these different channels and changes. And that is exactly why and what we should be doing. So I'm glad that you did point that out. It is important in any graduate school that you choose, those who may be thinking about graduate schools, to make sure that you do have faculty and staff who are connected, who will connect you, who will make sure that you are in networks, and then who will also challenge you and challenge your thinking to broaden it, or to make sure that you are specifically focused on those things, so that, again, you won't spend any more time than you have to being in school. Sean, you're about to graduate, and before we got on, we were kind of getting a sneak peek of what you're thinking about doing or considering your work to be after graduation. So tell us about some of the things that you're planning to do after graduation, and how has being in this program helped you to consider what's next on your plate?
Yeah, so most of my career has pretty much been in direct service. Over the last maybe 7 years or so, I've been more intentionally focused on actual systems level transformation. And I'm leveraging the theory of meliorism. If you are unfamiliar of what meliorism is, I encourage you to look it up. But it is basically a theory that says we accomplish large scale transformation through incremental change. So I think, sort of to Megan's point, right? You can accomplish everything in a year, but if you take small bite-sized pieces out of things, then you have a larger impact. And so what I am working on is developing a health tech and digital media social enterprise to address the primary care physician shortage that we are experiencing across the country. If you're unfamiliar of what that current challenge is, I highly, again, encourage you to look that up. But leveraging also digital media storytelling to address medical mistrust and enhance provider-patient relationships, as well as increase health literacy. I think most of the country reads on about a 7th grade level, but the information that we are providing to them from our healthcare spaces are not accessible at that level. And so I want to make sure that we have the necessary tools, that we're actually talking to each other. I come from a time where, I remember we could actually have sit-down conversations even if you disagreed. You know, there was a moment where you wanted to get to a point of just simply understanding who people are,
Mm.
how their experiences shape how they navigate the world and the systems around them. And I think we need to do more of that. We've become so polarized with each other across so many different lines, politically, economically, racially. And I think it is really driving us a wedge between how we actually respond to the systems that are overarchingly impacting us all. And so I'm looking forward to launching the venture shortly after graduation, partnering with a lot of my classmates who have knowingly and unknowingly already served as user testers for the idea. Megan knows, she's been in a group with me and they've been giving me great feedback on where to change. And then also working with some of the professors as well. I mentioned some of the tools that we have been able to leverage here at the School of Global Health. That are really going to be instrumental to helping me map and figure out where we need to drive resources.
Wow. See, that's a testament to networking and to building those relationships that you all talked about earlier. It's important to build those relationships, even though you're in a hybrid situation and you may not actually see each other in person every day, but you all have taken the time to build relationships, which ultimately, you know, you're launching a startup, and your startup is going to encompass some of the people that you've built network around or with, and really dealing with the medical mistrust. And I again, I appreciate how you stated many people read on a 7th grade level, but the information, the material is way beyond that. So a lot of times you might just have people nodding their heads and believing that they understand, when most time they don't. And then that builds a bigger, wider gap on health equity and things of that nature and mistrust. So I'm looking forward to it. Again, I wouldn't be surprised if you have some people that knock in your inbox to try to figure out what this startup is going to be about. Make sure you have a disclosure, though, before you start disclosing your work out there, Sean. All right, Fawn. So you talk to a lot of the professors, and you've gained relationship, and you've been in these spaces with some of the professors. Talk about, you know, how have professors, their professional experiences translate into the classroom to help provide these examples, or this exposure, if you will, beyond the academic setting?
Yeah, thank you. That's a great question. So we have had some remarkable, amazing professors to be able to teach us and help us on our journey. I'm thinking of Dr. Celeste Phillip. And when you look at her background and knowing that she was formerly with the CDC, she's formerly with the Adventist healthcare system, and just many of the work that she has done. And she's one of our professors that we have. We've got Dr. Chastity Walker. She is also formerly with CDC, but also she worked overseas in Africa for a very long time. So, and then their connections, you know, we had an assistant ambassador come in and speak in our class at one point in time. So it is Dr. Rishi Manjada. You know, he owns Health Begins, and comes in and he actually teaches with us. So we are really getting the cream of the crop, so to speak, when we are talking about the education that we're receiving at Meharry. We've got Dr. Lynn Todman. She's just came on board, and so happy to have her. I've recently had a meeting with her, and to echo what Megan was saying, you know, one of the things she said to me is that this is not your final destination. Like, your work is going to, what you really will be doing, and your mark will come sometimes maybe years after you do your PhD, right? But this is just I like to say it's your gas station on your journey of where you're going, right? So it is important that you build those connections. You, Dr. Howard, are my career mentor, you know, and in all that I do, I reach out. And so it's great to build those relationships. When I think about being at Gillings School of Public Health, My career mentor there and my advisor was Dr. Vaughn Upshaw. She's still in connection with me now. So it's about building that relationship and building genuine relationships. It's not transactional. It's reaching out even when school isn't going, checking in, how you doing? Just sometimes it's not even long conversations. It's just sending a meme, just letting people know that you're thinking about each other. So you're building relationship so that when you hit a hiccup, because it's not an if, it's a win. When you hit that challenging moment, they will know and they will swoop in and they will be the ones to say, okay, look, you got it. It's okay. Have your moment, process. Now let's recalibrate, because you're going to deal with imposter syndrome as soon as you hit this door at Meharry, because you're going to look around and you're going to see those other students in your classroom. And Meharry has some high caliber students that they have recruited. They're in C-suite positions. They're business owners, entrepreneurs, they're Aspen Fellowship graduates. These are people who are really coming to make a change in this space. And you're going to probably sit there and try to do a comparative, where am I right now in this world? What am I doing? Do not compare yourself whatsoever. We're all starting at ground zero. We're all getting a PhD. This is the first time that we come through the Global Public Health opportunity together. So we all don't know what we don't know in that same space. So just make that connection. Build with your professors. Stay in somebody's office hours if you can, and after hours, and then that should be able to help you navigate this space. And these are genuine relationships. These are not superficial relationships. These are not relationships. Oh, the last time that you talked to somebody was the last time you had a class with them. So yes, I would encourage you definitely to sit with your professors, pay attention to what they're saying. And if they tell you that you can reach out to the connection or the person that they had come and speak, do exactly what they said. Go to LinkedIn, what have you, introduce yourself, make those connections, because you don't know how that's going to build an opportunity later on.
Yeah, no, that's really, really good. The professors here, as you named, some of them are amazing. One thing that I really appreciate that our school does, and our dean, is to ensure that we have what I like to call scholar practitioners. And so those are faculty who are not just have been in academia, they have been in the industry. They've been in working at hospitals and government, CDC, you name it, mayor's office, C-suite, because we want to make sure that we're bringing that level of experience to our students. So for those of you, again, who might be considering the School of Global Health, who might be considering Meharry, I want you to know that this is the real life. These faculty, they are in the industry, they are working, they have worked, and it's important to build relationships. It's important as you are students in any program to build relationships, because these relationships and these networks, they can open doors, or they can, even if they don't necessarily open the door, they can be an assistant to making sure that your story is framed, it's told in the best possible manner. So I do agree that it's important to have those relationships. Jayla, you will have sort of kind of our last question, and we have a few more questions. And those of you who've been commenting, thank you all so much. If you have questions, we may have time for a couple of questions. Please drop your questions in the comment section. Please make sure you drop your questions, and we'll try to get to a couple of them. But Jayla, cultivating relationships, it's really, really necessary in the public health space. How have you been able to create these or forge these relationships and build connections that has helped you not only in the program, but now that you're getting ready to graduate, as you'll go beyond? How have, thinking about these programs or these relationships, how have you been able to cultivate these relationships?
Mm-hmm. So I've learned that relationships are at the heart of public health, and that's definitely true in graduate school too. From the start, I've just always been intentional about connecting with my classmates, not just in class, but outside of class. as well as my professors. So our cohort is really small. It's about 13, 14 of us. So we make a real effort to stay connected. Like recently, we just started a book club with each other, which is so cute. We have group chats, of course, where we just check in with each other, remind each other about assignments. We even plan activities outside of class, like we're going to tulip picking on Saturday. And those moments have helped us to hold each other accountable, but share perspectives and support one another through challenges, which has made the program feel like a true community, which is another form of what public health is about. Beyond the classroom, my work with community organizations and advocacy initiatives like reproductive health outreach and local public health programs has taught me how to build trust and communicate across differences and collaborate with diverse partners. So really bringing that mindset into my cohort has strengthened my ability to work in teams, solve problems collaboratively while still maintaining those meaningful connections. I'd say the biggest takeaway is that relationships aren't just helpful, but they're essential, especially the connections I've built both personally and professionally have helped me to grow and stay motivated and prepared me to engage communities effectively and make a real impact as I move into my actual career within public health.
Wow. Relationships are not just helpful, but they are essential. Ooh, I love that. I'm going to borrow that. The first time I say it, I'm going to give you credit. The second time I'm going to say, well, somebody said it. But by the third time, it's going to be mine. I'm going to be like, relationships are not just helpful, they are essential. Thank you. That was like a clock that T or whatever that you all do. So, oh my gosh, I love that. I love that. Relationships really are essential. So as we are winding down, we do have a couple of questions. But before I ask the one question, I want you all to take just like 30 seconds and talk about what has surprised you most about your growth as a student. Like 30 seconds. What has surprised you most about your growth as a student? We'll start with you, Sean.
Yeah, I think just moving from that individual personal responsibility level and really honing in on where the system level gaps are and trying to find solutions to that. I think someone said earlier, may have been you, Dr. Howard, that there are so many avenues to go down in the public health space and trying to figure out, where do I quite fit in with my multitude of experiences and perspectives? And so, yeah, really solving the system level challenges we're experiencing right now.
All right. Fawn, what about you?
I will say my confidence. Confidence in knowing what I know. Oftentimes I used to be that person that would make a statement and following up behind it, I would say, do you know what I'm saying? Or do you understand what I'm saying? That type of thing, as in a validation, as if the things that I was saying was not, good enough to stand on its own. And so now my statement is what it is. If you need additional clarity, then ask me, but I don't have to seek validation for that. So my confidence level, and I directly attribute that to my cohort. My cohort will check you in a heartbeat when you are having a moment and they will say, get it together, and to Jayla's point, it really is, relationships are essential. I have a doctoral bestie, her is Shannon Stevens, and we talk at least 3 to 4 times a week, about class, what we're doing, what's going on about our kids, raising kids, as single moms, and, just everything that we're doing. And when I have my moment, she and I have Bible study together also. And I'll say, remind me of this when I go through this situation, because I know that I'm going to have that moment, and so just having that confidence level now, especially public speaking, I've seen it refined even more. Meharry has given me a lot of opportunities.
We got a shift. I'm sorry. I'm so sorry because we got our time. And
I know, so it's given me a lot of opportunities, and I just thank the opportunity to have confidence. So I could go on.
Thank you. Yes, your confidence is great. I love it. Megan.
So what has surprised me the most has been my ability to be resilient, specifically my ability to write 10 to 15 pages papers back to back within a week, and my critical thinking skills and communication. But beyond the workload, I've been surprised by how the program has added layers to my thinking.
Awesome, awesome. And Jayla, what about you?
I'd say for me, definitely my growth. It hasn't just been about what I learned in the class, but how I adapt and how I connect with people and how I face the unexpected.
All right. So there's a question to really sharing about the practicum in the PhD, your practicum or PhD learning, especially if you've traveled abroad for it. So if someone wants to answer quickly, now we know that we're going, global health students are going abroad in the coming months, but does anyone want to talk real quickly about your practicum or PhD learning experience, especially traveling abroad or looking for what you were hoping to gain traveling abroad for it? Well, I will say this. Go ahead.
Yeah, I was going to say, I have not traveled abroad specifically for my theses, although I have traveled abroad and worked in public health systems, mainly in Costa Rica. But I think for me in the medical mistrust avenue is really just talking to my friends and a lot of people, a lot of other Black males that work in the space and how they navigate the healthcare system and hearing their stories. And that's sort of what motivated me. But I also see the intersection of those challenges geographically as well and globally, having, lived in Central America before.
All right. And so again, for those of you who are listening, our school will be traveling abroad. So that is certainly something you will have forward to look to as you come to the program at Meharry. One word, each of you, one word. If you could describe your Meharry experience as we're closing up, one word that would describe your Meharry experience. One word. Let's go.
I'll start off. Again, the word resilience. Historically, Meharry has always been about breaking strides and overcoming obstacles, and I see that same spirit in my classmates every day. Whether it's through the faculty's encouragement or leaning on one another during a tough week, we are constantly reminded to be the best at what we do. So it really comes back to the School of Global Health's model, we, not me.
All right. Fawn, your one word.
Alignment.
Alignment.
Alignment is my word. Alignment. It aligns with my values, it aligns with my purpose. And so alignment is my word.
Awesome. Alignment. Jayla.
For me, I'd say transformative. Moving here, I had a lot of ups and downs, but I've grown a lot mentally and emotionally too. And I've learned to navigate obstacles and embrace that discomfort. And I've grown in how I think and how I approach problems and how I see the impact I can have in the world. So Meharry has definitely taught me. It hasn't just taught me, but it stirred something in me and opened my eyes and ignited a drive to kind of make a difference that I know I'll carry beyond these walls.
All right. And Sean.
Mine is affirming. I'm exactly where I'm supposed to be in the moment that I'm supposed to be there with the people who I'm sharing this experience with. And so, yeah, I'm feeling very affirmed and ready to tackle the issues that confront us.
Wow. Affirm, resilience, alignment, and transformative. Well, I want to thank you all so much. Thank you, Fawn. Thank you, Jayla. Thank you, Sean. Thank you, Megan. Thank you to our back crew, Maya, for just an amazing conversation, you all, today. My heart is very, very thankful. I'm thankful that I get to serve here alongside you all and alongside our leadership and our faculty. This has been an amazing conversation. And I hope that those of you who are listening, if you're interested in learning more about what we do here at Meharry, you'll join us for one of our information sessions. We have an information session coming up tomorrow. You'll learn more about what we're doing. If you look at the bottom of the screen, there's our website rolling through. You can register for the open house that is tomorrow. Click on or scan the QR code to learn more about our programs, our Master of Public Health, our Doctor of Health Administration that starts this fall, that will be online. Our Master of Public Health has moved now to hybrid, so you don't have to come to campus but a handful of times. Our PhD in Global Health Equity and our PhD in Health Law, Policy, and Management. This, if you want to learn more about it, again, you see the QR code for our open house tomorrow, or just go to our website to learn much more about what we're doing and how our students continue to evolve and do the work that you've seen. So again, from all of us here at Meharry Medical College in the School of Global Health, on behalf of our Dean, Daniel Dawes, thank you all for joining us this afternoon or this morning, wherever you are. And we look forward to learning more about you and hearing from you. Remember, please share what we're doing with someone. And thank you so much for joining us.